Hello, everybody. How's everybody doing today? I'm coming live and I wanted to discuss an issue. And I wanted everybody's input, like I always do. I love when people voice their opinions. And that's what I'm basically doing today, is my opinion. Um, but I wanted to play a clip before I come back and voice my opinion because it makes me wonder. The judge is now have a case that is pending in court about contraceptives, and I want to know your input. So I'm gonna start. I'm gonna play this, and then I'm gonna come back and give my opinion.
A federal judge in Texas spent 4 hours today hearing arguments in a case that could decide the future of access to the drug mifepristone, which is used in most medication abortions in the U.S. NPR's Sarah McCammon was in the Amarillo courtroom and joins us now. Sarah, you were in court today. Take us there. What was it like?
Well, just to kind of paint a picture, Juana, Amarillo is a smaller city. It's the better part of a day's drive from the major cities in Texas like Houston and Dallas. And it's a tiny courtroom. It just seats a few dozen people. They allowed in a small group of reporters and members of the public. And some of us were lining up there around 5 a.m. local time. This was really important, though, because the judge, Matthew Kasmerek, would not suspend courtroom rules that prohibit cameras or recording. He also refused to make a live stream available to the public. So the only way to know what was said was to be in the room for this very high stakes hearing, which could cut off legal access to the pill mifepristone at a time when it's increasingly difficult to get an abortion in many states.
Well, we are certainly glad you were there. What did you hear in court today?
Well, the anti abortion rights group who filed this lawsuit wants to force the Food and Drug Administration to pull mifepristone from the market. They say it was improperly approved. And it's important to know mifepristone was actually approved more than 20 years ago for use in medication abortion. It's been used since then by about 5 million people. Major medical groups say it has a very strong safety record, but it does bring about what is essentially a miscarriage. And there are sometimes complications with that. And that is what lawyers for a coalition of anti abortion medical groups and doctors called Alliance for Hippocratic Medicine focused on today. One of the lawyers, Aaron Hawley, argued that doctors who are part of the alliance have been forced to treat patients who've taken mifepristone and are experiencing complications like heavy bleeding. She said in some cases they've been forced to provide a surgical procedure to complete the abortion, despite their deeply held beliefs. Now, in response to that, a lawyer for Danco, which is the company that makes mifepristone and has also joined with the FDA in fighting the lawsuit, that lawyer noted that all drugs have side effects and suggested treating patients is a normal part of being a doctor in those situations.
And Sarah, you mentioned that this group argues that the abortion pill was improperly approved. What's their concern?
Well, there is a long list of fairly technical concerns, and I won't get too deep in the weeds. They date back to when the drug was first approved in 2000. For example, they point out that when the FDA approved mifepristone, that approval relied on kind of an obscure regulation for drugs that treat serious illnesses. Alliance lawyer Eric Baptist really objected to that language and said, quote, pregnancy is not an illness, as he argued that the approval was improper. Now, lawyers for the FDA responded that pregnancy can be life-threatening for some patients, and they also said regardless of whether you describe it as an illness or a condition, the wording is irrelevant to whether or not the drug is safe.
Okay, and what else is the FDA arguing?
Well, the Department of Justice is arguing this case on the FDA's behalf, and DOJ lawyer Julie Strauss Harris pointed out that mifepristone has been around for decades. She said taking it off the market would cause harm to patients who rely on it. Judge Kasmerek noted that Republican attorneys general from more than 20 states that have tried to restrict abortion after last summer's Supreme Court decision, they filed a brief in the case, and they say that the wide availability of abortion pills undermines their state restrictions. So the judge asked Strauss Harris what she made of that. She said, that's beside the point. She said the FDA approval simply confirmed the drug's safety and effectiveness and doesn't require anyone to prescribe it or take it. And she said, quote, The plaintiffs are the ones who are trying to dictate national policy with this lawsuit.
Sarah, you've been following this, and as you've reported, the federal judge who's presiding over this case has long-standing ties to conservative groups. Based on what you heard in court today, any sense of what's on his mind?
Well, he asked a lot of questions, especially about how he might rule in the case. He seemed to be considering whether he should order the drug to be taken off the market right away or order the FDA to take some kind of other action. Lawyers for the FDA asked the judge if he should side with the plaintiffs to be precise and focus on addressing specific concerns. There are a number of ways the judge could rule. Whatever happens, it's likely there will be an appeal.
NPR's Sarah McCammon in Amarillo, Texas. Thank
Okay. Wow. Okay. So, what do y'all think about the video? Uh, where this is in court. Um, there are two different pills, type of birth control pill. You got the morning after pill, which is different from the manifold pill. They are both for contraceptive, uh, but they are different. And they're different that the morning after pill, because if they're coming from one pill, eventually they're going to come for the other pill to be removed. And with several states, I think they say 20 states, has made abortions illegal. And so the only thing that women basically can use is these pills, the morning after pill, which is approved by the FDA. But they're asking for it. If they're asking for these drugs to be removed off the shelf, um, what kind of risk are you putting women in that wants to use these pills? So I'm gonna go over some things. The morning after pill is a type of birth control that can be used in emergency situations when typically birth control was not used, failed, or in some cases, non-consensual sexual intercourse or rape. The pill is effective at preventing women from getting pregnant if taken quickly after. So after intercourse, and a woman decide, if in some cases I do think they need it, because when it comes to rape, um, nobody should be forced to have a baby if that's not what they want. Um, Having sexual intercourse without any form of birth control, experiencing birth control failure, a broken condom, uh, the woman has forgotten to take her birth control pill, or she's missed doses and just want to be safe. And especially when it comes to non consensual sexual intercourse, such as rape. So that's what Plan B is. You don't need a prescription to get it. You can go in any drugstore and purchase it. Um, Now you can. But the morning after pill is intended for backup contraceptive only. It's not used as primary to say I want to abort a child, and that's the difference with the morning, with the Plan B, especially if someone has been sexually assaulted. Now that's different. Both of these drugs have been approved by the FDA. Plan B, you can buy it online, in stores, in almost 50 states. in the United States. You can do a same day delivery, curbside, pick it up, have it shipped to you. So it's pretty much worldwide that you can get this particular contraceptive if needed. Now, here's the difference. You have to keep in mind that the morning after pill is not the same as manifold pristone, which is also known as RU 486 or the abortion pill. And so this is what's in court now. They're asking the judge to have the FDA go back and pull this particular drug off the counter because they feel that it's an abortion pill. And in states wherein abortion is illegal, I guess this is where they're asking the judge to have the FDA pull this particular pill off. So it's a little different. The morning after pill, if a egg has entered the uterus, which means it's at the point of a baby being conceived, Plan B pill won't work. You have to do a Plan B pill soon as you plan, right after intercourse. Uh, that's when Plan B, one step is used as a backup to make sure you don't get pregnant. However, with this manifold prestone, it's different because they're saying this is an abortion pill. And if they ban abortion in several states, then they're saying that they want to ban this particular medication that has been used since 2000. And the FDA has approved it, which means that they felt that it was safe. But since some feel that it's an abortion pill, this is the argument that's in the courts that they want this particular one removed. Now, if you remove this one, are you going to come back and have another lawsuit saying Plan B needs to be removed? Because technically, you'll have women wanting to use Plan B if they can't get a hold of the other one. If they feel like, I guess, if they feel like they are pregnant, then they're going to want, and they don't want the child, then this is where the this is where the mifepristone come into play, because I think a woman can use it up to 2.5 months after she's had intercourse, which means she could be pregnant. And this particular pill will cause her to have to lose the baby. So it's just like another, it's a pill for abortion. That's what they feel like it is. So that's sort of the difference between the two contraceptives. Um, so my thing is, does a woman have the right to choose? And I think with them stopping the abortion in several states, that's not giving women the right to choose what they want to use with their own body. It's their body. What do you care to do with it? If you choose to have this man baby or you choose not to, when does it become life? Is it life? Uh, because that's when one of the biggest arguments in court was about life. When does it become life? When the fetus, when it becomes a fetus, or after 2.5 months? which in some cases the baby has already started to develop. So I would like to see what happens in this case because both of these drugs are approved by the FDA in since 2000, uh, and they saying up to 10 weeks into a pregnancy, a woman can take this pill and it would induce the pregnancy where it abort the pregnancy. So should this drug stay on? I think this has become an argument. It's a fight over the reproduction health care in wake of the Supreme Court decision to overturn Roe versus Wade. In the United States, more than 3 million women in the United States have used this mifepristone. I don't know if I'm pronouncing that right, but y'all understand what I'm trying to say. Uh, you've gotten over 5 million to 3 million women in the United States that has already used this. And so I guess now it's coming an argument. Should it remain on shelves for women to get it in spite of them uh, not being able to get an abortion? Should they still be able to get this pill? And that's going to be an argument. And I guess they're waiting on the judge now to make the decision. Do you think it should stay on the shelf for women? Or do you think the judge should have the FDA pull this particular drug? What are your thoughts? I mean, it's been on for past decades. Women have been able to, to use the drug. Um, and then you have women saying it's not your uterus, not your decision. Your woman should have a right to choose. And if she can't go out and have an abortion uh, in those states, would she be able to use a pill to abort the child, to abort the pregnancy? Because if she does it in early stage, it's not even a pregnancy. So I'm not going to say abort the child. So, what are your thoughts? I would love to hear your comments. It makes a big difference. Do you think a woman should have a right to choose what she wants to do with her body? Or do you think the judge should make a decision for women? Because if you're pulling this particular drug off the counter, which is what women could just go in and purchase it, don't need a prescription, don't need anything, but it does help you or prevent you from having a pregnancy that you don't want. Should the judge say, no, we're going to tell women what to do with their bodies? So, what are your thoughts? A woman have a right to choose, or the woman should not have a right to choose what to do with her body? I feel, and this is my opinion, that a woman should have a right to choose. Uh, I think if she's doing the plan B, especially should stay on the shelf, especially when it comes to rape cases or in cases where a man have forgotten a condom or she forgot to take her birth control. Um, I feel like she should be able to get the plan B. Now, the other one, which is really an abortion, I guess that's up in the air. I do feel like women have a right to choose. It's their bodies. Who am I to say what you should do with your body? So I do feel women should have a right to choose. It's their body. And a judge should not be able to tell a woman what to do with her body. But in several states, abortion is not legal. So they are telling women pretty much what to do with their body. My issue is it going to raise teen pregnancy? And that's what I think about teen pregnancy. Are we going to see an increase in teen pregnancy due to the overturn of Roe versus Wade? I'm quite sure we are, because if they can't abort a pregnancy that they may not want, then you're going to have an increase in pregnancy among teenagers, probably adults too. Um, and what's going to happen to children where the parents do not want their children? That's, you say put them up for adoption. There are a lot of kids up for adoption now. Um, if she leaves her child somewhere, what does she need to do so she won't end up in jail? So it's a lot of issues that people aren't talking about that definitely needs to raise issues and be talked about. You know, what does she do if she don't want the baby? Uh, what is a safe place? I know they put things, well, like leave it on the church or take it to the fire station or take it to the hospital, leave it in the hospital, you know, different things that they could do so women won't go to jail. And I think that's another issue that needs to be raised, especially in states wherein you're telling women they can't have an abortion. Uh, so I would like to see what does happen. Are they going to pull this pill off the shelf uh, to prevent women from aborting a pregnancy? Or are they going to leave the pills on the shelf, especially for cases like Plan B? Uh, it's like get the Plan B early enough where you won't need the other pill. So you got to be real careful as a female. Um, I don't know. Or are they going to end up trying to pull both off the shelf in states that where abortion is illegal? I guess that's up for debate. All right, I would like to hear your input. How do you feel about it? Do you feel that the pills should stay on the shelf for women that do need it? You've got over 3 million to 5 million women that have used it. So that's telling you, should it stay on the shelf or should they pull it? And then you run the risk of having a lot of unwanted pregnancies, and what will happen to those children that are unwanted. So I would like for you to leave your thoughts. Let me know what you think. Uh, I admire your feedback. Uh, Thank you for dropping in and have a great day. And if you like some of my topics, please subscribe to my channel. Leave your comments. I love the comments. And hit the notification so whenever I upload a video, you'll be the first to receive it.